Good afternoon, everyone. Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic and to reiterate to residents the importance of maintaining the provincial and local health orders ahead of the Canada Day holiday on Wednesday. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today we'll be hearing remarks from Councillor Keith Egli, Chair, Ottawa Board of Health, le conseiller Keith Egli, président du Conseil de santé d'Ottawa, followed by Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence, Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique. Available for questions from the media following the statements, we also have, disponible pour répondre aux questions des médias, nous accueillons aussi Dan Chenier, General Manager, Recreation, Cultural and Facility Services, Directeur général des loisirs, de la culture et des installations, and Pat Scrimger, Director, Transit Customer Systems and Planning, Transportation Services, Directeur, Système client et planification du transport en commun, Direction générale des transports. After we hear from panelists, we will hear questions from the media. We will now begin with remarks by Chair Keith Egli.
Thank you. Hello. Bonjour. Kwe. It's hard to believe that Canada Day has arrived, but I do welcome a time to celebrate our national pride and our community spirit in the city. Although things are going to be very different this year, I encourage you to celebrate this important day and just ask that you do so responsibly. I want to reinforce Ottawa Public Health's messaging regarding COVID-19 and all celebratory events. First, please remember to assess your own personal risk level before planning any event. OPH advocates strongly to avoid being in enclosed spaces with others, avoid sharing food or drink, and to avoid crowded areas. We ask you remain COVID-wise and practice physical distancing, wear a mask, perform regular hand hygiene, and stay home if sick. Our nation's birthday does not stop the fact that COVID-19 is still very much in our community. We must remain vigilant. Community members of a certain age with certain medical conditions remain at risk of life-threatening complications if infected with this virus. I sometimes feel like I'm a bit of a broken record or maybe even a nag, but it's true. It's true. The best way to fight this pandemic is to practice distancing, wear a mask, perform hand hygiene regularly, and stay home if sick. COVID-19 aside, there are other things we ask you to consider this Canada Day. Protect yourself from typical Canada Day heat by limiting exposure to the sun, staying hydrated, and paying attention to how you feel. If you are planning on taking advantage of our city's beautiful green spaces, please remember that ticks can be hard to see, so please ensure you conduct a tick check once you are done your outdoor activity. Lastly, if you are planning on drinking or using substances, please do not drive, and remember that anything can be cut with deadly opioids such as fentanyl. As the summer heat continues, residents are increasingly utilizing outdoor splash pads and wading pools. These are excellent resources that help families remain cool and comfortable while having fun in the summer. Although there's no available research that states that COVID-19 can be spread through properly treated water, it can still easily spread if physical distancing is not respected when using these facilities. We ask patrons to be vigilant with regard to spacing between bathers. I believe that after Ottawa's long winter, our community deserves to have a nice and enjoyable summer. I just ask that we do so responsibly and with each other's best interests in mind. Thank you.
Thank you very much, Chair Egli. We will now hear from Anthony DiMonte.
Thank you. Bonjour. We know a lot has changed in our daily lives since the emergence of COVID-19. And as the Chair of the Board of Health indicated, there will be different celebrations this year for Canada Day. As a result, the iconic Canada Day celebration on Parliament Hill is going virtual this year, and popular community gatherings are canceled in order to comply with provincial requirements. Despite all these special event cancellations, the city will enter situational awareness on July 1st and has developed a 2020 Canada Day plan. The scope of the plan includes monitoring gatherings at city parks, beaches, and locations that have traditionally hosted Canada Day celebrations to ensure compliance with regulations and health guidelines. We will also be monitoring city service delivery and that of our external partners, among other things. We are all aware of the resurgence of COVID-19 in some jurisdictions, and no one wants to see that happen here. We must all resolve to celebrate Canada Day responsibly this year to protect the gains we've made together to keep Ottawa on track and in stage 2 of the provincial reopening plan. If you plan on visiting a park, remember to practice physical distancing and leave alcohol and fireworks at home. Do not litter and keep the space enjoyable for everyone. Cette année, nous devons tout faire résoudre la célébration de la Fête du Canada de façon responsable pour ne pas freiner notre progrès que nous avons obtenu et maintenir Ottawa sur la bonne voie qu'elle puisse franchir la phase continue de phase 2 le plan provincial. Si vous envisagez visiter un parc, n'oubliez pas de respecter les mesures de dissociation physique et de laisser vos boissons alcoolisées et vos feux d'artifice à la maison. Ne jetez rien par terre et gardez l'endroit propre pour tout le monde. Bylaw officers will patrol city beaches and parks and will be available to respond to any issues that may arrive on restaurant patios. As always, the focus will be of these patrols to continue on awareness and public education. The city's beaches in Mise, Westboro, and Petrie Island will have lifeguards on duty for Canada Day. Britannia Beach remains closed for the season-planned riverbed restoration work. For all those taking to the water, whether making use of backyard pools or waterways, please remember to keep a close eye on young children and make sure they are always within arm's reach. If you're using any kind of watercraft, please mind everyone's safety and have appropriate number of personal flotation devices on board. Fireworks are permitted on private property with the property's owner's permission, but must be directly supervised by an adult. It is prohibited to discharge fireworks in city parks unless you have attained a permit, and no such permits have been issued this year. So if you plan to watch fireworks on your street, please maintain the required physical distance from anyone not in your household circle. To help facilitate local transit within our communities, OC Transpo has developed a detailed Canada Plan schedule, which you can find at octranspo.com or on the city's website at ottawa.ca. A reminder that customers are required to wear cloth masks when entering buses, train stations, and paratranspo minibuses and contracted taxis. Please do not use transit if you're unwell or sick. Ne prenez pas les transports en commun si vous êtes malade. Finally, we'd also like to encourage all residents to consider supporting local businesses as they prepare for the celebrations. Nous invitons tous les résidents d'appuyer les entreprises locales alors qu'ils se préparent pour célébrer la Fête du Canada. I hope everyone has an enjoyable July 1st. Let us continue to maintain the positive trends in our response to COVID-19 by acting responsibly this Canada Day and every day in support of our community and country. J'espère que vous passerez une journée agréable le 1er juillet prochain. Maintenons nos bonnes pratiques sanitaires face à la COVID-19 et agissons de façon responsable le jour de la Fête du Canada. À chaque jour par la suite et soutenons notre communauté et notre pays. Merci beaucoup. Thank you.
Thank you, Mr. Imonte. We will now hear from Dr. Vera Etches.
So this year, Canada Day is going to feel a little different. With no signature events downtown or large community gatherings, you may find yourself finding new ways to celebrate Canada Day. The most Canadian thing we can do is to continue to care and protect each other by being COVID-wise during our celebrations. And however you choose to celebrate Canada Day this year, I encourage everyone to continue that physical distancing, wear a mask when physical distancing is not possible, limit your contacts in number, and stay home if you're sick, and of course, always washing your hands. J'encourage tout le monde à continuer à pratiquer la distanciation physique, à porter un masque lorsque la distanciation physique n'est pas possible, à limiter vos contacts à l'extérieur, à rester chez vous si vous êtes malade, et à pratiquer une bonne hygiène de laver des mains. So the provincial orders in place allow for gatherings of up to 10 people. And we still know that the fewer contacts you have, the less case, the transmission can occur. So while planning your Canada Day activities, here's some things to keep in mind that promote safer celebrations. Try to keep the celebrations outdoors in places where physical distancing can easily be followed. Avoid potentially crowded areas like parks or beaches. And celebrate with those inside your social circle, those 10 people at the most where you've decided to have closer connections. And keep that social circle of yours separate from other social circles. Consider the level of risk of your activities for yourself and for those in your social circle. If there are others who are at higher risk, such as older adults or people with weakened immune systems or chronic health conditions, take extra precaution. Essayez de faire en sorte que les célébrations se déroulent à l'extérieur, dans les endroits où la distanciation physique peut être facilement suivie. Évitez les endroits potentiellement bondés comme les parcs ou les plages. Célébrez avec ceux qui font partie de votre cercle social. Et tenez compte du niveau de risque de vos activités pour vous-même et pour les membres de votre cercle social et votre ménage. Certain groups sont plus à risque. Let's celebrate our country and our city by protecting those who live here. And as we continue, we're moving through stage 2 of reopening. We're continuing the hard work that has allowed us to get here. We're seeing second waves emerge in other parts of the world. And while we're fortunately in a much better position here in Ottawa at this point, we are also at risk of a second wave. We can watch other countries and communities to learn about what works to control COVID-19 and adapt approaches for what's appropriate in our city. So currently case numbers are steady, outbreaks are decreasing, but we're maximizing our testing capacity and our ability to contact trace. This is good news, but the positive case numbers that we see updated on our website every day are still just a fraction of the infections still present in our community. À l'heure actuelle, le nombre de cas est stable, les éclosions diminuent et nous disposons d'une capacité suffisante de tests et de recherche des contacts. C'est une bonne nouvelle, mais nous devons demeurer vigilantes. La COVID-19 est toujours là. Le nombre de cas positifs que vous voyez chaque jour sur notre site web ne représente qu'une fraction de ce qui est réellement présent dans notre communauté. So the risk of an increase in COVID-19 cases and outbreaks, again, is real. Modeling data shows us that a decline of just 20% in our public control measures could lead to a second wave. Our actions influence whether that occurs and how severe. So Ottawa residents have already shown that they're capable of doing what needs to be done to keep the virus at a manageable level. Nous avons le contrôle sur la gravité de la situation. Les habitants d'Ottawa ont déjà montré qu'ils sont capables de faire ce qui doit être fait pour maintenir le virus à un niveau gérable. And our community spirit is strong. So according to phase 1 of our engagement strategy, the majority of residents, 90%, agreed or strongly agreed that they would be willing to wear non-medical or cloth masks in order to be able to access services. 3/4 agreed or strongly agreed that they'd be willing to wear a non-medical mask or cloth mask in a workplace. And now preliminary data from phase 2 of our engagement strategy, which started just last Thursday, so far indicates that 71% of residents wore a mask in indoor public spaces either most of the time or always in the last 7 days. This percentage has been growing. And we continue, though, to observe room for improvement in mask wearing to protect each other. While the data shows that many people are already doing the right thing by wearing a mask, we are seriously exploring our options for making masks mandatory in commercial settings in Ottawa. I'm having conversations with the mayor, our city partners, our neighboring health units to make sure that we're all well coordinated in our actions. And I anticipate providing an update on the decided approach before the end of the week. It may be uncomfortable to wear a mask, especially in warmer weather. However, wearing a mask will protect others. If you're able, please wear a mask when going somewhere you cannot guarantee the ability to physically distance. If you're not sure if where you're going may require a mask, it's a good idea to get in the habit of keeping one on your person at all times. My mask protects you, and your mask protects me. Le port d'un masque est un petit sacrifice si cela signifie sauver les vies. Wearing a mask is a small sacrifice if it means saving lives. Now, it's exciting news that the beaches are open. This is a great way to cool off and enjoy time with those in your household. Our advice is to avoid the larger crowds where you're maybe unable to physically distance and protect yourself and those around you. And if you do plan on spending some time at the beach this summer, be sure to remember those COVID-wise basics. Remain cautious of communal areas such as washrooms and high-touch surfaces. More information can be found on our website, as always, ottawapublichealth.ca. So this summer will be different from those past, and still, I hope you can use this time to create many wonderful memories of a summer overcoming the challenges of COVID-19. Bien que cela puisse être différent, nous espérons que vous pourrez utiliser ce temps pour créer de nombreux merveilleux souvenirs un peu différents. Being COVID-wise is important, and it's key to helping us move into stage 3 and beyond. I wish everyone a happy and safe Canada Day. Merci, et je souhaite à tous une bonne et heureuse fête du Canada.
Thank you very much, Dr. Etches. I will now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Again, a reminder to remain on mute until I invite you to ask your question. So we will now start with Deborah Reeder at 1310 News. Sorry, everyone, I was muted this whole time. So we will now go to questions from the media. As usual, you can have one question and one follow-up. We will begin with Deborah Reeder at 1310 News.
It's Deborah Ryder, and I just wanted to reiterate, are you bracing yourselves for a lot of foot traffic? Even though you keep reiterating that everyone is going local? Virtual? Are you anticipating a lot of foot traffic from outside sources aside from local?
Well, as I indicated, we're prepared for anything. We hope people heed Dr. Etches and our public health colleagues' recommendations not to gather in big groups. We're anticipating a beautiful, sunny, and warm Canada Day, so that as well brings on challenges with regards to the warmth and people being careful and hydrating appropriately. So we'll have all the emergency services, all the support services ready for particularly the Byward Market and the beaches and the large parks that every year we normally see organized events. So we hope if people do gather in those areas that, they maintain their social distancing, they have a good time and enjoy Canada Day, but to be reasonable. And we're ready to intervene and encourage people to move on if they have to. But we think, people have now gotten into the beat and they are successful. We have been very successful as a community, and we hope that continues. But it is Canada Day, so we're prepared for any eventuality. But we certainly hope that we have a nice, enjoyable Canada Day. We don't have any data to indicate otherwise.
Okay, thank you.
Thank you very much, and I apologize for mispronouncing your name, but would you have a follow-up, Deborah?
Just the amount of police that were on Canada Day, police presence from last year compared to this year. Are you still bracing yourself?
I think, the word bracing always means that we're expecting something major to happen. We will have all the assets that you've seen in previous years deployed. Um, the posture we've taken this year, you have to understand when we have our big Canada Day event on the Hill, when we have major events in Canada, Orleans, elsewhere in the city, they're organized, they're structured, we know what we need, and we kind of know the presence that are required for traffic and to help people along. This year is kind of a bit odd because we don't have any of those major events, so it's going to depend on how people decide to celebrate and where they decide to go. So the appropriate resources are deployed; they'll be everywhere. And what we're going to do is our posture is more as things evolve, we'll be able to move our resources appropriately to help for traffic control, to help people who are in any situation that they may need assistance. So it's going to be more that type of operational event. So I would say it's like a normal day. When 911 calls come in, we'll be responding accordingly. Or when calls for assistance come in for whatever, we'll be responding accordingly. So you'll see the same presence of all the emergency services, including bylaw, that you would on a normal Canada Day.
All right. Thank you very much.
Thank you very much. We will now go to Joanne Chianello at CBC Ottawa.
Thanks, folks. Also, Keena, you weren't muted, so we could hear you, so no problem. Thanks, and nice to see and hear all of you again. Both for Dr. Vera Etches and Mr. DeMonte. The idea of making masks mandatory for accessing services, if you could expand a little bit more on exactly what that might look like, what that might mean. Do you mean existing services or the next stage? And also, Mr. DeMonte, how do we enforce that? We've seen on OC Transpo, we're not enforcing it, and some people are doing it, some people aren't. So perhaps you guys could explain a little bit more how this might work.
So we're looking seriously at the different options to make wearing a mask mandatory indoor spaces in businesses where people have limited ability to stay 2 meters apart. There are different ways to move forward with this and different options for enforcement. And so this is part of what we're talking to our city partners, bylaw, legal, our neighbors, about making sure we have a consistent approach and something that we can clearly communicate across our area. We know that a lot of people are doing the right thing, wearing masks, and we appreciate that this culture is shifting. A growing percentage of people are using masks to protect others and to be protected as others wear their masks. But we also hear that there's room to grow and improve that. Our experience on public transit has been very positive. Where that's been made mandatory, people are showing up with masks, people are wearing them. I think that that tells us a lot in this city about people's willingness to do what's right and what's helpful. So I think it's going to take a little bit longer to decide on a specific option, but we anticipate being able to announce that by the end of the week at the latest.
Yeah, so Joanne, Dr. Etches and her colleagues have been looking at the data and as they've done throughout this crisis, brought us forward some good evidence-based decision-making from a medical standpoint, and they're now looking at this as perhaps something that we need to do mandatory in these settings. If it becomes mandatory, yes, we will put enforcement tools in place. We're just beginning to explore what that would mean. There are several options, under the provincial order. There's probably a way there that we could use that as a tool. There are other tools that give medical officers health authority. Some of those tools are legislatively, I would use the term, more clunky, or we could use something more elegant. Perhaps we could develop a municipal bylaw that would also, the approach the provincial order, the fines and that are what they are, and we can't modify that. Under a bylaw, we could have something that could be less severe. It would still be a fine, but it could be less severe. And so we're starting to explore that with our team, as Dr. Etch has indicated. As they start looking at the science and whether that's going to be the recommendation. We've had some preliminary discussions. We're looking with our legal team. We're looking with our bylaw team. What would be good tools that we would need if we need to use them? Obviously, education will be our priority. And in cases where there may be a bit of resistance, certainly we'll try to encourage people and give warnings. But yeah, ultimately, we will perhaps develop a tool. And to your point, it could probably then expand and be used. I know there was a lot of discussion about OC, but the special constables in OC, if we had a municipal bylaw, could enforce that if we allowed them, and police officers can enforce a municipal bylaw as well. So that seems to be perhaps a path we may look at. But again, no decisions have been made. We're just in the exploratory phase, and we're doing a lot of work in the background. And we'll certainly see if Dr. Etches and the rest of the medical community feel that's the next step we should take for our community. They've shepherded us through this successfully, so we'll develop some tools to support them.
Joanne, if I can just add quickly, we've had some very engaged discussions, Dr. Etches and myself, over the last number of days. We had a good discussion this morning with Mr. Demonte, with the mayor. So we're looking at all options. But it's a discussion I think that we need to have. We've been hearing from members of the public. We've been seeing other jurisdictions take this step. So it's a discussion we need to have, and we intend to have it as quickly as we can and as thoroughly as we can. And as Dr. Etch has pointed out, we'll have more on this by the end of the week.
Yeah, as a follow-up, I mean, I was just going to ask, like, what has precipitated this? For example, I wanted to ask about the outbreak in nail salons in Kingston. They've had such a great such great success at keeping the numbers down there. Now we see two nail salons, there's a big outbreak. And I'm wondering, is that a concern here? Are there some sorts of businesses that pose greater threats to COVID spreading? Is that something that masks could help? I mean, where did this all come from? And I would kind of like to know about the nail salons. That's a weird thing that two of them had outbreaks, right?
Yes. So, at Ottawa Public Health, we've been early adopters of the promotion of masks to protect others. This is something we've been strongly recommending for a long time, and we've been monitoring the use and the uptake, and we've been encouraged that percentage of people reporting that they almost always or always wear a mask has been growing, but it isn't as high as those who are practicing physical distancing, which is very excellent. Most people are, and that is important. The physically distancing is a first protection to stay far away from others. When we're moving through stage 2, we know that's a risk. We know there are more businesses open. There are more people asking for services that bring you into close contact with others. And so, yes, there are some personal services like nail salons offer or others where that contact with the patrons is within 2 meters where you can't physically distance. And so the use of a mask is very important. The idea of making this mandatory is something that's been a conversation actually for a while, but we're seeing it progress in terms of other jurisdictions also making this mandatory, where they've had higher rates of outbreaks or and I think the idea when we take a look at Kingston is, perhaps we don't want to wait for an outbreak to happen. Let's get ahead of this. Let's make sure that all the hard work we've done so far to keep the numbers down and the outbreaks dropping is able to continue. We want to move to stage 3. We want all the businesses to be open. We want people to be able to continue to get back to work. That's so important for health, the health of our community. And so again, more interactions with people, more close contact. Wearing a mask is an extra layer of protection. And if we can prevent cases, that's what we want to do. There's no treatment for this virus. Most people will manage the infection quite well, but not everybody. We want to avoid those serious outcomes.
Yeah, Joanne, I think the short answer is we don't want to lose ground. As Dr. Etch just said, we've done very well in Ottawa. The residents of Ottawa have been excellent in following advice from public health. And as Dr. Etch just said, we would like to get back to normal as safely and as quickly as we can. And everything we can do to add another layer of security or safety is something that we need to consider.
Thank you very much.
Thank you.
So we will now go to Josh Pringle at CTV Ottawa.
Thank you very much. Just picking up on the mask discussion that Joanne was having or asking about. Any worry that you might get some fight back from residents about mandatory masks? I know the city was a little reluctant to go to mandatory and hoping that people would embrace the mask. 71% is good, but probably not as good as you'd like to see. Any worried, any blowback to possible businesses moving forward if face masks become mandatory?
I'll start, but if anyone wants to add, please do. You know, we've been talking with our business community for quite some time, even the early days when we started to think about recovery. What does recovery look like? And even then, masks came up as one of the things that businesses may need to incorporate into their new way of operating. And I can tell you that many businesses are looking for clear direction around whether masks are required or not. And so, you know, a step to making mask use mandatory indoors where people cannot maintain 2 meters from each other is also about leveling the playing field, right? So that all businesses have the same standards. They all know this is what we need to do to protect our employees and protect our patrons. And then the public knows that whatever business you're going to, that's the expectation. So it makes it even across the board, and people understand what to expect. So that is helpful, we've heard, to businesses. Now, of course, you've heard me say, I mean, encouragement works the best, and people doing the right thing because they want to do the right thing works the best, and that's what I expect to continue. You know, people in Ottawa have been really clear they want to protect others, and this is maybe something that will provide a little bit more clarity about how to do that, because it has been you know, a pandemic where the situation evolves. We need to adapt and keep learning as we go. And so this is a way of helping send that message that I think may just increase that use of masks a little bit more.
Josh, as Dr. Etch has said, we've had excellent compliance from people in the community, but taking the next step towards making it mandatory, I think reinforces just how important public health and the city believes that mask wearing is going to be in getting from stage 2 to stage 3 and not losing that ground that we've already worked so hard to achieve. So I think it reinforces that this is a very important consideration going forward. It's not one that we take lightly, and as Mr. Demonte's spoken to, I have, and Dr. Etch's, we're consulting at political levels, we're consulting within the community, we're consulting Dr. Etch's within her medical community and the bordering medical officers, the health and public health units. So we're not doing it lightly, but I think it sends the message that if we make it mandatory, that this is an important step, and more importantly, it's an important protection that we can add to our toolbox in holding on to the progress that we've made and pushing that forward.
Just a quick story. I was in a place this morning. Out of 12 people, I was the only person wearing a mask. So compliance is all around. Second question, with Canada Day here, the numbers are down. We haven't seen a spike in cases, first from the Black Lives Matter rally at the start of the month, and since we moved into stage 2. Are you worried that people might get a little complacent and think that the virus is not in the community and they can maybe expand their social bubble a little bit safely? That
That may be for me. The sense of success is good. It's nice to recognize when we've achieved something collectively, and that encourages us to keep doing the right thing. However, the idea that there's a first wave and the virus is gone and we're kind of just going to wait and see if a second wave comes is a bit misleading, because what is happened is we've pinned the virus down. We're holding it to a really low rate, and it can rise again if we let up our pressure and let up our good actions, like physical distancing. So it's too early to change, the cautious approach. And I hope that people continue to do what they have been doing.
Thank you very much. Moving on, we will go to Craig Lord at Global Ottawa.
Thanks. It's a question for Dr. Etches. I was just wondering if you could share some of your thoughts on the proposed in-class rollout that we saw from the Ottawa Carleton District School Board over the weekend that would see 2 weeks or 2 days in class and then a day for cleaning and then 2 days for another group. Just curious if we can get your perspective on whether you think that's a strong approach to potentially restarting in class come September.
Well, I'm glad to see the Ministry of Education and our local school boards looking at how to get students back into the classroom. I think this is really important. We've been looking at some of the unintended impacts of the pandemic, and we know that children's development is really important, and that in-person connection with their teachers, with their classmates, something we want to get back to. I haven't had a chance to discuss the approaches with our local school boards yet. That's on the agenda this week. And so I do need to understand a little bit more what their thinking is behind the different options. My understanding is that they have plans that they can adapt based on the actual situation of COVID in the community at the time. I'm sorry, it's a bit early for me to have a defined comment or position on the approach at this point.
No worries. Shifting gears a little bit back to Canada Day. This may be a question for you, Dr. Etches, as well as maybe Anthony DeMonte. But just wondering, we're probably going to see some backyard parties, that kind of stuff, or gatherings, whatever you want to call it. But wondering what is the best, in your opinion, approach to regulating those parties? We might see people spilling into 11 or 12 person gatherings, and what should a neighbor do in that circumstance? Is it put in that call to bylaw and crack down, or what's the best approach from your mindsets in mitigating those little bendings of the rules these days?
So the best approach to celebrating Canada Day is with your household members and the members of your social circle. So that's the people that are close to you, that you've decided are going to stick to only that group of 10 for close interactions. And for gathering that include others beyond that, you want to do that in a way that keeps 2 meters between people. And of course, outdoors, again, is the best. So I'm glad we're going to have good weather. I think that will facilitate outdoor gatherings. And I think people have got the hang of this idea of keeping 2 meters away from each other. I've seen it in parks. People are having gatherings. They sit far apart from each other. They bring their own food. They're not sharing utensils. There are a lot of practical ways to come together and celebrate without being too close. So that's what we're recommending. I think that if there's ever a major concern, there's always the opportunity to call on enforcement. I think our colleagues at the city can speak to how they handle that.
Yeah, I mean, enforcement is a tool. It's not something that should be where we go right away. Dr. Etches, I think, has just described a good scenario. I hope neighbors aren't counting, your neighbors in the backyard and calling bylaw. I wouldn't want to see that. Obviously, if there's a big party with 50 people and there's challenges, certainly call us. But I would encourage everyone in the community, like we've done to date, to continue being responsible and continue to heed the advice and the direction that public health is giving us. We've been successful. We continue to be successful. I think we can have a great Canada Day, nice weather outdoors, enjoy ourselves in our social circles, and be responsible. That's the solution. Enforcement is not the way to go. So we prefer to not have any calls of bylaw. Certainly, if there's a major issue, don't hesitate to call us. And if it's in a life-threatening situation, it's 911. But other than that, let's continue down the path we are. You've heard it from the chair. You've heard it from Dr. Etches. You're hearing it from me. We have been successful. The results speak for themselves. Let's continue down that path. And Canada should be no different.
Great. Thank you both very much.
Thank you very much. Nous allons maintenant suivre par Julien Paquette, le droit.
Bonjour, ma première question, ce serait pour M. Dimonté. Vous avez évoqué la possibilité qu'il y ait une forme de répréhension ou de conséquences pour les gens qui ne porteraient pas le masque, advenant le cas où on adopte le masque obligatoire dans les endroits publics. Est-ce que ça impliquerait, est-ce que ça comprendrait aussi les transports en commun qui, pour l'instant, ont les masques obligatoires, mais il n'y a pas de mécanisme pour...
Oui, au fond, Dr. Etches et ses collègues sont en train de regarder la science, l'évolution de ce qu'on a fait à date, et ils vont prendre une décision basée sur cette analyse-là, si c'est nécessaire de mandater le port obligatoire dans les endroits définis. Si on va de cette voie, on regarde au niveau de l'intervention, si vous voulez, les règlements municipaux ou au niveau au niveau provincial, ce qui est déjà en place, ça serait des outils possibles pour nous. Notre objectif, ça serait de continuer à éduquer les gens que si jamais on va cette étape-là. Et si on passe, moi, ma préférence, on vient tout juste de commencer ces discussions-là pour mettre ça en perspective. Il y a 3 options possibles, un nouveau règlement municipal plutôt, le règlement provincial qui existe déjà, ou en vertu de la loi de la santé publique, il y a des ordonnances que le Dr. Etches, comme médecin sanitaire, peut ordonner. Mais ces 2 derniers sont un peu plus complexes, puis c'est plus juridique dans son application. On regarde peut-être un règlement municipal qui nous donnerait une capacité d'intervenir aussi avec des amendes qui sont pas mal moindres que le niveau provincial, parce que ça, c'est l'autre problème. La loi provinciale définie, c'est 800 $ ou 1000 $. C'est énorme. Tout ça pour dire que oui, à votre question directement, si c'est un règlement municipal, on peut élargir les gens qui ont l'autorité. D'abord, les agents de règlements municipaux peuvent le faire. Un règlement municipal peut être également utilisé par les agents de la paix, dont la police. Et nos agents au niveau de OC Transpo, on sera en mesure de leur donner des autorités également. Donc, ce serait un outil pour eux si on va cette voie-là. Mais je répète, on commence nos discussions, sont préliminaires. Tout d'abord, est-ce que le Dr. Etches et ses collègues vont procéder à recommander que ça soit mandaté comme tel? Si oui, faut que ça soit d'une part par les élus autorisés et votés, et par la suite, on regarderait les outils nécessaires. Mais oui, pour aussi Transport, ça serait un outil qu'il pourrait utiliser si c'est nécessaire.
Merci beaucoup. Oui, non, évidemment, c'est pas encore confirmé qu'on ira dans cette direction-là. Ma sous-question, en fait, ce serait justement sur le taux de succès de l'obligation de porter un masque dans les transports en commun jusqu'à maintenant. Je sais que le Dr. Etches a mentionné que c'était positif. Et je peux répéter la question en anglais au besoin, mais j'aimerais aussi entendre M. Scrimger là-dessus. Comment on a calculé finalement ce taux d'adoption?
So for the question in English, oh, sorry, go ahead, Pat.
Sorry, go ahead. I want to make sure I get it correctly.
I just wanted to hear you about on the success level of the mandatory mask of wearing masks in transit. So how good has it been so far?
It's so we're 2 weeks in now. It's been very good. In the first week, we were seeing 90 to 95% of our customers wearing masks, and it has only continued to climb since then. It's all, these are all estimates. So it's very high, continues to be very high, and there's a increasing number of customers who are coming prepared, bringing their own masks. Our staff are still distributing a few thousand every day for those people who come who do not have one with them. But the observations from very early on that first week were that most people were coming with their own cloth mask.
Thank you, Mr. Cringer.
Merci beaucoup. La dernière, mais pas la moindre, Stéphanie Allard, Radio-Canada.
Oui, bonjour. Je sais que vous avez déjà répondu à quelques questions sur le port du masque obligatoire en anglais, mais j'aimerais vous entendre en français également, savoir où en est la réflexion et qu'est-ce qui vous pousse à soudainement envisager le port du masque obligatoire?
C'est pas soudainement que je veux que tout le monde porte les masques à l'intérieur quand c'est trop difficile de faire la distanciation physique. Ça, c'était mon recommandation depuis longtemps. Mais aussi, on a une nouvelle situation avec cette stage où on commence des activités, des services, les travails à l'intérieur où il y a un plus grand risque d'être en contact avec quelqu'un entre les 2 mètres. Et ça, c'est important parce que on peut voir une éclosion, par exemple, à Kingston, et la possibilité existe ici. On veut prévenir les éclosions, on veut prévenir les cas parce qu'il n'y a pas un traitement pour ce virus. C'est clair que pour tout le monde, c'est possible de combattre le virus, mais aussi, ça peut causer des grands problèmes et aussi les décès. Alors, ça, c'est une décision de continuer avec le message de prévenir les infections. Et c'est aussi que maintenant, nous avons les données que la population utilise les masques pour la plupart. C'est la majorité qui indique qu'ils portent des masques à l'intérieur quand ils ne peuvent pas faire les distanciations physiques. Mais ce n'est pas une grande augmentation pendant les derniers mois. C'était comme 60% de la population qui a indiqué qu'ils portent les masques, mais maintenant c'est 70% et on veut voir un plus grand nombre et avec l'opinion de notre entreprise aussi ici, c'est aussi intéressant pour les entreprises d'avoir la même obligation pour toutes les entreprises. Alors, il y a différentes raisons pour cette action maintenant, mais le but, c'est de prévenir les maladies.
Pouvez-vous m'expliquer un peu quelles sont les prochaines grandes étapes à franchir et dans une période de combien de temps est-ce que ce serait possible d'imposer le masque obligatoire à l'intérieur?
Nous avons des conversations maintenant pour déterminer l'approche et c'est probablement possible de communiquer cette semaine, avant la fin de la semaine, notre décision pour l'approche. Et toujours, comme M. Demonti a dit, c'est important d'avoir une période de communiquer avec la population et les entreprises, d'aider les gens de trouver des masques s'ils ont besoin. Alors, le début d'un nouveau règlement, ça commence avec l'éducation aussi. Je vais offrir l'opportunité à M. Demonti d'ajouter quelque chose.
En fait, je rajouterais tout simplement, comme le docteur Etches a dit, elle et ses collègues sont en train de faire leur réflexion à savoir si la recommandation médicale va être le port obligatoire. Si oui, on a un processus interne, on regardera quel outil qu'on va développer au niveau d'intervention pour les gens qui ne le porteraient pas. Faut qu'il y ait une consultation, évidemment, au niveau politique avec l'ensemble du conseil pour une décision. Et par la suite, si cette mesure encore, il y a beaucoup de travail à faire, si c'est le cas, il y aura une période d'éducation, d'information, etc., avant qu'on commence même à intervenir au niveau règlements municipaux, si vous voulez. Et même au début, ça va être de l'éducation et des avis plutôt qu'une intervention corsée. C'est sûr, l'objectif visé, c'est qu'on porte, si c'est la recommandation, que tout le monde porte un masque dans ces conditions-là.
Merci.
Merci beaucoup à tous pour votre temps. Thank you everyone for your time. Have a great day. Bonne journée.